I think it's a very interesting question to ask, which is, let's just think about December 2019, January 2020. How many people globally would have thought that the COVID-19 black swan event would have such a profound impact on the global economy, on the South African economy, on the South African mining sector, and on the world's population and on South Africa's population? I think a lot of people would never have believed that this was possible. The mining sector is certainly one of those sectors through the Minerals Council, well organized, and over the last 20 years, actually in fact 25 years, we've learned a lot about the management of pandemics, whether they be the HIV/AIDS pandemic or whether it was to do with the TB challenges that we've been facing. So the mining sector, through our processes that we like to, that we have employed in the way that we manage particular crises, applied a risk-based approach. We put in place all the preventative controls, all the mitigating controls, in order to enable us to get back to work, in order to enable us to manage the pandemic, and in order to, to enable us to basically save lives, at the same time. So just a little bit of a chronology to share with you. I mean, in January, the World Health Organization had come out indicating that COVID-19 was a public health emergency. By February, the Minerals Council had already circulated to its members and through its Health Policy Committee a set of guides in relation to the National Institute of Communicable Diseases and the World Health Organization guidelines on how one manages a coronavirus outbreak. By March, WHO had already declared the COVID-19 as a global pandemic. We further then provided guidance to our members. We started working on a 10-point plan. The 10-point plan very much, again, based on a risk-based approach with a number of key drivers in relation to preventative controls. Preventative controls are around social distancing, around the use of personal protective equipment, around proper sanitizing and washing of hands, and in terms of even right through into communities, behavioral conditioning, of encouraging even communities, members of communities to do their bit in washing hands, social distancing, wearing face masks, etc. We adopted the 10-point plan. Our board adopted that plan. We started working on a standard operating procedure for the sector. And by April, and obviously working quite collaboratively with the DMRE, both Minister Mantashe, the Chief Inspector of Mines, David Msiza, the DG, Thabo Mokoena, a significant amount of work was done about, how we could make sure that these standard operating procedures were implemented by all companies in a way that would obviously implement these preventative and mitigating controls. Preventative, again, being the social distancing, sanitizing, etc. And then the mitigating controls, once you found someone who may potentially be positive, you want to isolate them or potentially quarantine them. You want to make sure that you do tracking and tracing of anyone who may have been exposed to that person. And obviously you want to test that person to see whether they are positive or not. And then you want to put them in, want to have available quarantine facilities, et cetera, et cetera. In April, we had issued guidelines on the use of personal protective equipment for fighting COVID-19. By May, the DMRE had published their mandatory codes of practice for the mitigation and management of COVID-19, adopting a significant portion of the standard operating procedures that had been developed by the Minerals Council and its membership. We also then published a guidance on COVID-19 and its impact on vulnerable populations. That's people over 60 or employees that have comorbidities, particularly uncontrolled comorbidities. But at that particular stage, we had also started, and as far back as April, started really with a transparent view of how we did the testing, how many people we were basically screening on a daily basis, how many people we were doing testing of, and we were then following all the necessary protocols, and that was a very transparent view. There was a particular perspective that was given out there that mining's the epicenter. Just to be clear that if you're testing at double the national average and if you're doing more screening than any other sector, you are going to detect the cases, particularly the cases that come out of communities. And there's a wonderful adage, you cannot manage what you cannot measure. And the view of the Minerals Council and its members was, let's make sure we're doing very thorough screening. Let's make sure we really up our game on the testing side. And the industry did do a lot in terms of improving the capacity of a number of domestic private laboratories. Some of the companies did bring in additional testing equipment and machines to enable us to work more effectively. And we even were helping with some degree of testing in communities, et cetera, et cetera. By June, we the whole testing collaboration focus was starting to deliver good results. Again, we were doing roughly double the national testing average. We started working extensively within communities, providing food parcels, providing educational outreach about social distancing, about sanitizing, providing water services into various communities that didn't have water, and also obviously encouraging our employees going back into their communities to encourage their community members to follow all the necessary preventative controls, to manage the spread of the virus. Throughout this particular process, this whole process, we maintained a high degree of engagement with government. We also were engaging with the trade unions, the four major trade unions that obviously are related to the mining sector. And we even then started briefing, for example, the Portfolio Committee on Mineral Resources and Energy. We also then started looking at various research programs, not only in terms of the medical science and how it impacts on the spread of the virus and how it impacts on people's health, but also in terms of having the data, the geospatial data around where there are high infection rates, and being able to populate systems and understand, how various things have been changing over a particular amount of time. The companies themselves also had been developing their own facilities. There were some field hospitals that were handed over to local governments to help. We did have a degree of collaboration with the various provincial governments. At that particular time, we started engaging with a number of civil society organizations. We published a behavioral change field guide, which we shared and made, all this again available, to not only our members, but to the general public and obviously to municipalities, et cetera, et cetera. And we did this because, this is not a competitive game. This is a saving lives and saving livelihoods process, which we were involved in. And just to illustrate the point is that in August, we recognized that the Eastern Cape, it is an important part of the mining sector in terms of the fact that 15% of our labor originates from the Eastern Cape. And so we decided to fund the extra equipment into the Eastern Cape in terms of oxygen supply. We had a whole process that worked on that to go and help the provincial hospitals, oxygen being one of the key mechanisms that's used obviously for someone who may be suffering from COVID-19 to make sure that they're getting enough oxygen into their systems, et cetera, et cetera. So that was a 5 million rand program, in addition to the hundreds of millions of rands that were donated to the Solidarity Fund and all the work that was done, in various mining-related communities in relation to food parcels, water service provision, sanitization kits, et cetera, et cetera. By September, we had also launched the Beyond the Mine Gate field guide, again, empowering employees to try and encourage their communities and their own households to follow all the necessary protocols. And these are simple guidelines, but they're really effective in getting a message out there, which is this pandemic is with us. As much as we are seeing a decline in the number of new infections, as much as we're seeing the morbidity rates falling, we've got to be on guard. We've got to keep up maintaining our preventative controls as we have been doing, making sure that our systems are working effectively, and making sure that we continue exercising our standard operating procedures until we get way into next year. I think this is the new normal, and the industry has really been at the forefront. Maybe a last note to mention is that I think mining has actually been quite a pathfinding industry on these protocols and on these standard operating procedures, because we also spent a fair amount of time sharing with other business sectors the way that the mining industry handled it, which enabled us to get back to work quicker by putting in place all the preventative controls and mitigating controls, doing it on a risk-based approach. And so we were very happy to share with our other business association colleagues the work that we were doing, and hopefully we had some impact outside of the mining sector on encouraging change. So certainly from my perspective, the Minerals Council and the mining sector in South Africa, as has the mining sector at a global level, played a key leadership role in fighting this pandemic, in putting in place all the right protocols, procedures, and mechanisms, and recognizing that this is a pandemic that's going to be with us for some time, but it's also prepared us kind of like a white swan event for when the next potential pandemic hits us in terms of improving our preparedness, et cetera, for that type of event.